because I would persist like a very diligent person to my remedy. But at some point that indicated remedy would just refuse. This is where the genetic and the theme of the nosode and the intercurrents come up, and this is only when I read Chronic Diseases and I understood. It's a simple small book. I recommend each one of you should read it. And Hahnemann has very clearly written that you need these intercurrents for deep-seated cases, because the genetic predisposition is so strong that just the indicated remedy, because the indicated remedy itself becomes the nosode. That is where the nosode, so maybe it's a good point, we should maybe discuss the bowel nosodes, because with that we'll be discussing the other nosodes as well, that what are the indications for the nosodes. When the desperation is around, you know that, I mean, if your miasm is tubercular and you don't even enter a room because you feel there are people coughing and you're going to catch coughs or consumption or tuberculosis, means now it's beyond just the constitutional remedy, it's just the obsession with the disease which you are predisposed to. That is the theme of tuberculosis. And I cannot, I'm running out of time, I need to do so much. Can you shut that down? There's so much to do, there's so little time, and I can't afford to fall sick, and if I go in this kind of environment, I am going to catch tuberculosis. So the pace becomes hectic. It's like you're running out of time, so your pace becomes even more hectic. When it's all around that, you have to give a dose of bacillina. However well the tubercular remedy, if it is Ranunculacea and it's Cimicifuga, which is the tubercular component of Ranunculacea, which has done wonders up till now. At one point, when the obsession is just with the morbic influence of the disease that they represent, you have to give the corresponding nosode. It is the same with the sarcode. With the sarcode, if that whole thing is to do with the obsession of that particular organ, that till my doctor you give me any remedy, but now I have realized till you do not deal with my thyroid, no remedy is going to touch me. It is all about the thyroid. You say, okay, fine, we'll do something about it. Tell me about your skin. It's again back to the thyroid. If you do not deal with my thyroid, my skin dryness is not going to, you'll ask anything, constipation, dreams, how will I sleep? With the thyroid I am depressed. So it's all around the thyroid. If you do not give thyroidinum at that time, because the person is obsessed with that particular organ, that organ has become the person, then you will not, your indicated remedy will not work, because this itself is your indicated remedy. Because the indications are being thrown at you. We have to respect that and recognize it and respond.